The science of this therapy has not been understood for its entire existence until roughly 2008, when the Food and Drug Administration in the United States made an observation about hyperbaric oxygen that elucidated the science of it that no one in the field had appreciated, but was at the root of this, and explained the studies that subsequently were done. And specifically, the studies that were done were mal-designed, and that they had hyperbaric oxygen group and they had control groups where they put in a chamber, pressurized them, they gave them increased pressure and oxygen, which is a hyperbaric treatment. But the amount of it was thought to be negligible and outside the range of what hyperbaric oxygen typically is. And lo and behold, it was effective. And rather than acknowledge the science and the doctor's errors, they've doubled down now in this belief system, defending their error. And in the process, it makes all of these studies uninterpretable and confusing to the extent where they can easily deny that there's no proof and no science. And that's where we are.
So the control group was actually a dose.
It's a hyperbaric dose. It's a hyperbaric treatment.
Where the veterans did improve in the controlled group because it was just a lower pressure.
And rather than the doctors admit error, that there's new science, that we now understand that there's a new facet of this. And what it does is, in fact, show the effectiveness of the treatment in these studies. Instead, they have doubled down, and they've now conveniently changed the definition of hyperbaric oxygen to be at a certain high level. And all of the studies were done at a lower level and lower doses. So what it's done now is say, none of these studies are hyperbaric oxygen. We don't even know what they are. And as a result, nobody, at least the veterans, by default, civilians, because if they acknowledge these studies and it could be approved to treat veterans, it would be approved to treat civilians worldwide. It's flatly dishonest. And as John has suggested, even criminal, but I don't know what part of the criminal code this violates. It's just wrong on unethical. So many levels.
It's unethical.
It's that as well, yeah.
But it's weird because people are dying, so why isn't it criminal? It's just, it almost feels like organized crime, the way, that's just from my perspective.